most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about the #1 treatment for tailbone or sits bone pain. Plus, we're doing a giveaway.
Say no more, Bob.
So, and this actually fits quite well with what we're talking about today, because this actually would help you with tailbone pain or sits bone pain.
Sits bones.
Yeah, we're going to talk about it.
Yeah, so we can clear that up so we're all
we're going to give away 3 of these. So we'll talk about that when we show our social media channels here. But if you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free. We upload every day. And yes, if you go to our social media channels, you can go ahead and sign up for this free contest. BobandBradGiveaways.com. Otherwise, you go to Facebook. It's on there. Also, we're on Twitter, Instagram. All right, let's talk about what we're trying to solve here. With tailbone pain, we're talking about the coccyx here. And this often gets injured from a fall, maybe, or there's a lot of ways it can happen, actually. But generally, it's
people who snowboard have a problem with this.
Oh, sure.
Yeah, they fall in that area a lot.
Yeah, you know, it usually is an injury, wouldn't you say, from a fall or something like that?
Right.
So,
And they can take a long time to heal.
Right.
Months.
And while that's happening, we need to take the pressure off that. And that's why what we're going to show you today. But that's called the coccyx, and when you have pain there, it's called coccydynia. Dynia means pain, right?
Yep.
The other area that you can actually take pressure off by using these same cushions or use the little technique we're going to show you is the ischial tuberosities. These are the bones that you're sitting on when you sit on a chair.
Right.
You'll feel it.
Right now, I can literally feel my sit bones making contact there, especially if you're on a hard surface.
So now there's 2 things that could be going on here. Actually, almost 3 things, really. One, you could have a bursitis right at the tip of the bone here. There's a little fluid-filled sac that is underneath the tendon and the muscle right here, and that helps the tendon glide over the muscle.
And that happens to be the
the tendon glide over the bone.
I knew what you meant, Bob. That's why I didn't say anything. But that tendon happens to be attached to the hamstring muscles. Which,
right, and this isn't accurate, but this kind of gives you a depiction of how it works.
That's where it's there.
So you could also have what we call a high tendinopathy of the hamstring, which means that you've got something going on here in the tendon. 1, it could be tendinitis, and 2, it could be tendinosis. Tendinitis is inflammation. Tendinosis is tears or deterioration. Sure. This is what my wife had. Okay?
Either way, it's painful.
Either way, it's painful. So she absolutely did the thing we recommended today.
Are we going to show them?
Yeah, we're going to show them. Let's show them right now. So the first thing is you've got to take pressure off that area when you're sitting. I mean, it's just, in order for things to calm down, you just have to. And my wife, she actually didn't use this method. She used this method. I'm going to show you the free method first. Right,
what you can do at home.
You want to do it, Brad?
Sure, just take the pillow off your bed or wherever you can find a pillow. A throw pillow might work well. This is a bed pillow, obviously. Bundle it up like I'm showing here. Put it here on the front part of the chair, and if you got a soft cushy chair, it won't work very well. You need to have a chair that's firm.
A solid chair.
And right now my sit bones here are not, they're airborne. The pressure is through my hamstrings, and I can rock forward and back a little bit, and I'm clearly off that painful spot, particularly the coccyx. Right now, my coccyx is very well protected and has no force or pressure on it from the chair, so it works out well.
I've even seen this recommended, Brad, for people with back pain, because sometimes it kind of puts you into the arch.
Yeah.
You know what I mean? Naturally.
Right. So now if I go forward like this, it really helps my lordosis or my low back.
Yeah, we had a subscriber that said this saved him on a plane. Like he was like, what am I going to do? And he saw our video, and he said he just took the pillows and
I could see that you're pretty much stuck in that chair.
Yeah, you're stuck.
Particularly if you're right in the middle of two people.
So my wife, and this is where we got the Ergonomic Innovations is the name of the company. We'll have a link below. It's the Doughnut Pillow. It's made out of memory foam. And as you can see, it's got an area here for the coccyx or the tailbone, and also the sit bones. Take the pressure off.
Right. So, not only that, it has it this way as well. So it's coming from 2 different approaches.
Exactly. But I use it like this, Brad.
Okay.
I mean, that's how I found it to be the most comfortable. I don't know if you're going to be able to see it, but my sit bones are sitting right in that area now. And then the coccyx, because of that little canal here.
Yep.
that's free too. My wife, she had to put up with the jokes, of course, because it's a hemorrhoid pillow too.
Oh, sure. Yeah.
But she has one at work. She has one at home. I think she's kind of drifted away from it. I think it's finally feeling better. She had to have it in the car too. I mean,
just carry it with you.
I mean, she did. I mean, when it gets painful, when you're on a 2-hour trip, she was just being tortured.
Right.
So,
and again, these are slow healers, unfortunately. So you're going to use it for
they are very
weeks.
slow healing. Tendon can take a long time to heal. It can take up to a year. Get re-injured so it doesn't heal correctly.
Continues to be irritated, slowing things down. But
we did do a video on more of the treatment beyond doing this for that, and you can look for that under Bob and Brad. I think we put high tendinopathy, hamstring tendinopathy is what the title.
And I think we have it under a coccyx. Injury
probably too. Yeah. The other thing is, if you're going, well, I don't really have that kind of pain, I don't want to sign up for the contest. If you have a bony butt, I don't know.
Bony
if I
butt
should mention our name. One of our office managers, she has this in her chair. Did you notice that?
Yeah, I did.
And I think that it makes it more comfortable. I mean, it's just going to give you a more comfortable day, and it actually might help even position your back a little bit too. So
that would be like an ectomorph, right?
That's
technically speaking.
Endomorph, would it?
Oh, I'd have to look that up.
I think ecto is larger and endo is smaller.
Well, I'm sure we're going to get someone who knows. I'm going to look it up.
It'd be ecto, endo, and meso, right?
Yeah,
meso was the middle.
I thought ecto was a skinny person, the skinny butt syndrome.
All right, we'll find out. We'll get back to you. Thanks.